Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, we're going to talk with Christina Wirth. She has a master's in health administration. She's a registered diagnostic medical sonographer, and she's a registered diagnostic cardiac sonographer with Fetal Echo. She is an accomplished sonographer, mentor, and educator. Christina has over a decade of clinical experience in high-risk obstetrics, gynecology, and fetal echo. Recognized as Business Bureau's Imaging 2023 Leader in Sonography Award winner and Hospital of the University of Pennsylvania's 2021 Collaborative Award for Resident Teaching Excellence Award winner, Christina has expertise in clinical lab accreditation, CME planning and compliance, and ultrasound education events planning. In addition to regular clinical time, speaking events, and sonographer education activities, Christina has previously served on staff at the AIUM, providing leadership to the CME branch of the education and events team. She is currently on staff at the Fetal Heart Program at the world-famous Children's Hospital of Philadelphia, otherwise known as CHOPS. Please help me welcome Christina Wirth. Welcome, Christina Wirth, who is the creator of Echo Mentor. Welcome, Christina. Glad to have you.
Hi, Debbie. Thanks for having me.
You're welcome. So tell us first a little bit about yourself.
Sure. So at baseline, I'm a sonographer. I have been primarily in maternal fetal medicine now for, gosh, I guess going on 14 years, if that math works out.
Sure.
And, so my career has primarily been with MFM doctors and OBGYN. And then, in the last couple years, I was looking for some sort of career transition. I left clinical briefly to take on a educational role with the AIUM, the American Institute of Ultrasound and Medicine, where I was the continuing education manager. And really enjoyed what I did there with creating educational programs and a lot of their course planning and conference planning, but very quickly found that I deeply missed patients and wasn't somebody who could be at a desk all day.
Yes, yes. One of the very good benefits of our job, right? We're
yes,
up so many minutes.
absolutely. Yeah, I needed that
Move
activity.
around.
So after that stint was a little bit short-lived for me, although I kind of stayed as a volunteer for AIUM in different capacities. And then I returned to clinic and took a position at the Fetal Heart Program at the Center for Fetal Diagnosis and Treatment at the Children's Hospital of Philadelphia, which is where I currently am now.
Okay. And then how did you get into, or how did you come to having a passion for being a mentor or creating Echo Mentor?
Yeah. So Echo Mentor, I think, you and I talked a little bit about this when we were having some initial conversations, but Echo Mentor really was a passion project that was born out of kind of the conversations I would have with, my sonographer friends during our phone calls on our drive home from work when we were kind of unpacking the day or talking about where we wanted our careers to go, or really kind of the way that we wanted our life to look during the pandemic, which I know all of us had a great time during.
Yes. It was
So
just
you can,
a thrill.
right, you can probably imagine the exact type of conversations these were had. But Echo Mentor is really kind of a baseline, the community that we wanted to build within the sonography world. So Echo Mentor has continuing medical education credits because we think that that educational component is so important. But really, the bread and butter of Echo Mentor is offering mentorship to sonographers or ultrasound professionals or sonography adjacent individuals who may not have access to mentors within this niche of a community. And that was really important for me and my co-founder to build together, Haley Bartkiss, because we both know how much of an impact mentorship has had on our own careers.
Awesome. Yes, I know how much it has impacted my career, but I've also really have had the experience of it having a bad effect on my career as well, which is what gives the passion to want to be a good mentor, right?
Definitely.
So, tell me about your personal story of a mentor and
Yeah,
why that kind of helped you start to have this passion.
yeah, definitely. So early in my career, I think that I did what many new grads do, where we hodgepodge about 5 or 6 different PRN jobs together, so that we can get enough hours to pay back our student loans.
Right, right, right.
Uh, so that was certainly me at the beginning of my career, which I think was nice because it sort of gave me a wealth of experiences, but also gave me a wealth of different individuals who were in leadership or management, um, that I could kind of take traits and model behaviors from, that I felt served me in my career. And I could also sort of identify traits and behaviors where I felt this is never how I want to be in a manager, or in a leader or in a mentor. And
Sure.
I have kind of a really raw story that's on my blog that talks about a time, when I was working with somebody who should have been in kind of a mentorship role. And I had a really bad experience. And I remember coming home, uh, one night after a particularly bad situation and just curling up on the floor in my shower and thinking, like, I want to quit ultrasound. If I don't go back tomorrow, what other options can I do? Am I too far into it to
Right.
completely throw it away at this point? Um,
Right.
and as I sort of came out of that situation and grew from it, I remember looking back at it and just thinking, I never want to make someone feel that way. When I'm in a position where I have the opportunity to either do that or do something different. And I was lucky because I didn't stay in that position very long, and I had other opportunities that kind of came my way, that allowed me to sort of remove myself from that situation and get hours elsewhere and start, as I moved towards part time and full time employment, I kind of left that behind. Um, but through that, I also saw new leaders and new mentors who really exemplified, I think, the behaviors that we think of when we think of great mentors. And so I worked with individuals who were talented and passionate and kind, and very approachable. Um, and through that, I sort of started to see all of these people who really, really loved the field, really, really loved what they wanted, what they did, but somehow also managed to not have an ego about it, to not sort of do these transactional things with who would be their mentees. Um, and they were just really sort of there to kind of guide me and sort of build me up and make me into a great sonographer, and then give me opportunities beyond just scanning to help develop me professionally.
That's awesome. Yeah. I think we all can probably look back over our career, however long it was, and be able to say, this is the good that I took from someone, and this is not how I want to be from someone else, and different things. And then also just to be able to say, okay, we're all human. We've all had human experience, and maybe that wasn't a good day for them, or maybe that's not a good time in their life for them,
Right.
right? So learning to give grace there, sometimes, but as a student, it's hard because you're going into it not knowing, right? What
Yeah.
real adulting is like.
Right. Right.
Right? So yeah, I and even recently, whenever you start new jobs, right? I took a job not too long ago that I thought I would just love and adore, and I did. I really did, but the people there were like, "Oh, well, I'll go do it." I
Hmm.
didn't want you to do it. I wanted you to show me, like,
Yeah.
mentor me, like show me the actual knobs and buttons and, things that
Right. Right.
you do, um, and views and how you go to get those views, right?
Right.
So, very much more like, I talked to someone else that I interviewed for a podcast too about how maybe an older generation was just like trying to protect something, that they didn't want the younger generation to have or something. And how
Yeah.
many times we've really kind of come up against that uh,
Hmm.
quite a few
Yeah.
times.
Yeah. I mean, I think you kind of hit the nail on the head there because I think that sometimes people are threatened a little bit by seeing
Right,
people who are passionate and excited and who are growing, and they're a little bit threatened by, I feel like, the potential of what can be. And I think one of the common denominators of people who are great mentors is they kind of just put that aside. And they're almost like parents in a way. You want the next generation to be better than yourself. You know what I mean? And
right,
do you get
right,
anything out of that? I mean, indirectly. You
right,
experience maybe better staff retention, you experience a higher clinical acuity and sharp department. Um, you might recruit better people, but you yourself, those aren't accolades that you can add necessarily to a resume. Um,
right,
but I think some of the best mentors don't do it for that reason. You know what I mean?
right, right. Yeah, because at that job, there were certainly people who um, were older, but were much more willing to share information, and
Hmm.
help and just kind of come alongside you, right?
Yeah,
And say, okay, because, this is kind of a field where you kind of have to check your ego at the door, right?
definitely. Hmm.
Right? Like, I've been scanning for 28 years, but I'm a traveler. And let me tell you something, there is a gazillion different ways to do the same thing, right?
Right.
And so I'm not going to get my feelings hurt if you're going to tell me how to do it a certain way,
Hmm.
as long as it's done respectfully, right? I mean, I think we can all acknowledge that a little bit, but yeah, I think um you really have to take the ego kind of out of the way a little bit,
Yep.
and
Uh-huh.
just say, hey, why don't I come alongside you, and how are you doing, or what are you thinking, or you know um and then, sometimes it's just a matter of how you're introducing yourself to the patient. Hey, I'm working with so and so, and we're just working together today,
Hmm.
as
Yep.
opposed to I'm her senior lead, or, leading
Right.
with a title necessarily.
Yes. Yes.
So,
Because I
um,
guarantee if you say to a patient, this is my colleague, so and so, we're going to do your study together because two sets of eyes are better than one.
right,
That paints the situation in a much different light than saying, this is my colleague, so and so. She's only been working here 2 weeks, so I'm going to show her how it's done.
right, exactly, exactly,
And
right,
isn't the patient experience what it's all about, right?
right, right. And there are some times when you can't really, um, hold back, right? Like we're going to walk through this together and we'll explain things to you. But I mean, obviously, there's times when it might be a little bit more obvious that one has more experience than the other, but it's not, you don't lead with that, right?
Right, right.
Right. So I also like what you said early in our earlier conversations about how you kind of just naturally find mentors, right?
Yeah, yeah.
And
So,
mentors aren't always the same as leaders, right?
right,
Leaders
right. And
aren't always mentors.
yeah, and I definitely think there's some overlap in that Venn diagram. Because you can have people who are maybe managers, that are separate from mentors on the opposite end of the spectrum. And kind of in the middle of that Venn diagram where you have the overlap are people who I would consider leaders. And maybe that's in a formal capacity, maybe it's not. Because you can definitely have someone who's a leader in your department who does not have a title, but maybe is, publishing work or is taking on trainees or who is working with students. But at the end of the day, HR sees them as the same title as somebody else. But then you can also have people that have titles, that are not mentors and who are not willing to kind of coach individuals, or really help take them along their own ride to success, if that makes sense.
Right. Right.
And I think that's an important distinction. Also, I think at the opposite end, you sometimes have people who are mentors who may not see themselves as leaders at all. Maybe they want no additional responsibility, but they're kind of just taking in a junior sonographer under their wing and they're saying, stick with me. I'll show you where to put your lunchbox. I'll show you where the restroom is. I'll, help you finish your exams when you need it. And maybe they don't consider themselves a leader in the department at all, but this is still somebody who, for that individual who they're mentoring, is making a huge impact on the quality of their day to day.
Right. Yeah. I think we all make an impact on each other, right?
Definitely. Yeah. Yep.
So in a sense, I think we are all mentors, whether we really want to acknowledge it or not, right? Like you're either a good mentor or you're not, and I love to teach. And so sometimes my zest and excitement for, oh, what can I help you with? Or,
Uh-huh.
but also I think for me anyway, what I've learned is um, tell me how I can help you better
Right.
as a mentor. Like
Right.
open to everybody does and learns things differently. And
Hmm.
um, is there a way that would be better for you,
Right.
for me to help you, right?
Right. Right.
Um, so, ultrasound is a lifetime of learning, right?
Absolutely. Yep.
Technology's changing. We're always learning. We're always doing something new and different. And um, so to keep that in mind is like maybe you're just out of school and you're just starting your job and you've been there 2 or 3 years. And so now you feel like, okay, I've got it under my belt. Like I've got this figured out. But mentorship, I think, is kind of like that next level, right?
Hmm.
Of
Yeah.
here's the next level to career building to some
Right.
degree.
Yeah. No, and I think you're exactly right because I think most of us who find ourselves in mentorship positions wouldn't necessarily think of ourselves as mentors. And in fact, when I, about 8 years ago, I did a big move and I moved from upstate New York to Philadelphia. And when I came to Philadelphia, I brought with me kind of that knowledge of what that wealth of experience had taught me when I was in Rochester about the different things that I myself appreciated in a mentor and I myself appreciated in a leader. And so, as I sort of worked in a department for a few years that was new to me, and as we brought in new people, I tried to kind of exemplify some of those behaviors towards those new people. And I never thought of myself as a mentor in some formal capacity because I think I used to think of that word as some sort of formal relationship where, you have like a student who goes to a program director's office and sits down and talks about how's clinical going this week. And then the program director gives some sort of feedback, and then the student goes off and tries to apply it. And maybe they're successful, maybe they're not, but then see you again next week.
Right.
And so, it wasn't until probably a few years into that role when one of my sonographers, who Haley Bartkiss, who's now one of the co-founder with me for Echo Mentor, until she described me as her mentor, where I kind of thought, oh, me? Because I didn't think of myself that way. And then as other people started using that term to describe me as well, it kind of got me to think a little bit, what does mentorship actually mean? And I think that's where it kind of clicked for me, where I sort of realized that people or sonographers or people in the ultrasound field aren't necessarily looking for this formal relationship. We're all just kind of looking for somebody to give us some feedback and kind of give us input and insight and offer opportunities that might help us develop a little bit. And so when the opportunities came up, I knew at the time, Haley, for example, was getting her master's degree from Boston University, and she was really interested in
Nice.
teaching healthcare professions.
Mhm.
And so when an opportunity came up where we were going to expand one of our residency ultrasound education programs to start including family medicine residents, I knew I was kind of at capacity of what my bandwidth could hold in terms of learners because, at Hospital University of Penn, we definitely had a lot. We're a big teaching
Yes.
school.
Yes. Yes.
And I thought to myself, what would be really helpful to me and probably really great for Haley's career development is if I gave her this to take on and to really have it be her own, but was there to sort of coach her along the way so I could make sure she was successful. And in that, kind of let her do it her way, not try to micromanage or make the big decisions for her, and let her use whatever processes worked well for her. But was there to make sure, the I's were getting dotted, the T's were getting crossed, and kind of help her along that way. And I think that that's how a lot of mentorship initially kind of develops, and then can kind of blossom into something bigger from there.
Yeah, I think that's amazing that you had that revelation when she referred to you as that, that we
Yeah.
don't really recognize that that's kind of what we're doing. Um,
And it was
sometimes.
awkward at first.
Yeah, yeah. Well, and you probably haven't experienced this, but I'm older, and so some of these you girls, I don't know how young you are, but are like my children age, right? And
I, I
so I'm like,
appreciate that. The skincare
I
is
kind of
working.
feel like mother hen, you know, like, sometimes I feel like I'd have to call the supervisor to say, this doctor was on her ass so bad. Like,
Yeah.
it wasn't right. That isn't
Uh-huh.
good. Like, I need to
Right.
stick up for her to say, like, she's taking it because she thinks she has to, but that's
Mm-hmm.
not okay. Like, I get he was stressed, but, hmm, you know,
Yeah. Yeah.
and we're kind of getting away from that, unfortunately, with doctors working one-on-one with physicians, unfortunately, but still, I kind of got the sometimes the title of like mother hen. Like, I'm just making sure, does anybody need anything? Can I do anything for anybody? Like, uh,
Yeah.
how can we support each other in our day-to-day work,
Mm-hmm.
because
Yep.
let's face it, we're human and we're women, right? I remember walking into a clinic one day, and one girl, I think there were 4 or 5 of us. I can't, 4 or 5. And one girl had just had a miscarriage
Mm,
um, after IVF. One girl had lost a parent
mm,
due to some cancer.
mm-hmm.
Another one just found out that her child had special needs.
Oh,
And then another, another one had just lost her husband like 6 months prior, just
wow.
suddenly.
Ugh.
And I sat there and I thought, oh my God, like this is a nightmare. You know, like we all just need to sit down and have like a kumbaya, like take care of
Yeah,
each other. Like we need ourselves help, you know?
right. Yeah.
And yet we all showed up together, supporting each other to support the people and the women who came in, you know? And
Yeah.
I just thought it was such a beautiful day, uh, in a way, because we all supported each other, right?
Hmm.
Even
Yeah.
though we all had hurts, you know,
Yeah.
ourselves personally, we were all able to put those aside in order to serve more women, right?
Hmm.
Just like
Yeah.
us. So, um, I think mentorship goes not just professionally, but personally sometimes too, right?
Definitely. Definitely.
So, yeah, I just think it's definitely a need in our field. And apparently, other people have met that resistance of not wanting to share that information. Um, and when we don't talk to each other, we don't know that other people are experiencing that in other places, you know?
Right.
Uh, so it's nice to kind of put a voice to it that, yes, I've had these experiences. This is what I've taken from it. And this is what I am hoping to become, right?
Right. Yeah.
And help others with. So I appreciate your passion. And so how did you, so did you like grow in years of experience at a personal location? And
So
so do you have seniority and then that kind of helped give you mentorship
yeah,
tools as well?
well, so I think it's a combination. So I think that um when I initially changed institutions and came to Philadelphia, I didn't have necessarily a lot of years of experience when I was starting out there. But I think sort of what the physicians and my colleagues kind of grew to understand is despite maybe not so many years of experience as some of the we have a great team. Um, and there's a lot of wealth of years of experience. But I think what they realized is the quality of my experience and the knowledge that I brought to the team was also very valuable. And I think it was a little bit of a different perspective than what some of the other sonographers brought. And I think that they sort of saw that a lot of my contributions were really, really beneficial. So I came with a background of really working well with learners, and I came from a program where we had a lot of learners and they were really incorporated into our daily workflow. So when when I initially changed positions, the sonographers were a little reluctant maybe to take on some of those learners just because, it was a very busy department, with patients who often were either very sick themselves or had very complex pregnancies. And people just didn't feel like they had the bandwidth. But because I was coming from some place where that was commonplace and we had just sort of figured it out, and there were the structures in place to support sonographers to do that. And when I started kind of just championing to institute some of those structures here, I think that slowly sort of gained people's appreciation and gained people's trust. And I think out of that trust was born some of these experiences. So then I kind of slowly moved up into more formal leadership roles. I eventually was lead sonographer there. I was the continuing uh, the clinical coordinator for ultrasound education, where I had some of these formal titles that helped kind of champion, or I guess back up, sort of the work I was doing. But I think that developing that trust even before a formal title was so important because I think that that allowed the physicians to buy in, it allowed my peers to buy in, it allowed my leadership team to buy in, and all of that is so important when you're trying to kind of get your career to the next level.
Yes. Yes. That's huge, right? And consistency,
Yeah.
is huge
Hmm.
too, I think, with that. Yeah, I think Wow. I wish at my age that there was ultrasound people who would help and mentor through different things and ages and health issues. I've had health issues here recently that have certainly affected my bandwidth of
Yeah,
what I can mentally tolerate and not tolerate, right? And
right.
so being able to manage some of that
Hmm.
health issues with working such a high intense occupation, right?
Right, right,
This MFM certainly sets itself apart in the fact that not only are you technically needing to be very sufficient and skilled, but emotionally, you have to be
right.
quite savvy
Hmm.
and on the fly to be able to help manage expectations in the room and with some really difficult situations that people find themselves in, right?
Definitely.
With and I call it holding space
Hmm.
for people, regardless of where they're coming from and regardless of who they are or what background they have or what beliefs they have, just holding space for them to talk about their challenges or ask questions more about their particular situation. So you have to have a good sense for that with people, I think.
Yeah, yeah. And I think some of my friends will laugh because they call it my customer service voice.
Oh,
But
okay.
you know what I'm talking about.
I
That
do.
that sort of I'm checking my personal life at the door right now. And
Right.
when I walk into this room, I don't know who I will be necessarily, but I'm going to
Right.
be whoever this patient needs me to be in this moment. And then when I come back out of the room, I'll deal with the
Yeah,
dentist appointment I need to make or the vet appointment or whatever it is. But I think that all sonographers and especially our MFM sonographers do a version of this where they sort of wear a different mask sometimes, depending on
sure.
what that patient needs.
Sure. Or yeah. Right. Or yeah. Just managing expectations is
Yep,
should probably be a whole new different podcast, right?
definitely.
Lessons and I'll never forget not too long ago, first, first baby to a new couple, they're all excited. He's asking a ton of questions and he goes, "Wow, why don't you explain to me, the um saturation effect across the placenta through the cord to the heart. Why can you tell me all about that?" And I'm thinking, I do not have time to take you to school, And I'm like, I think that's a better a question to ask the doctor. And he goes, "Well, try me." And I'm like, I don't have time for that, sir.
Yeah,
And he got
yeah,
offended. He was
yeah,
very offended that I wouldn't answer his question. And I thought, oh my, like
yeah,
we
yep.
really need uh please watch this video before you go to your ultrasound,
Right, right. Yeah, so where I work in West Philadelphia, it's kind of an interesting dynamic of patients because many of our patients are healthcare professionals.
Okay.
And, we're kind of at the center of Penn, we're at the center of Drexel, we're at the center of Jefferson. So there's a
Okay.
lot of big medical institutions and big universities nearby where we're located in West Philadelphia. So we have quite the mix of people with MDs, people with PhDs,
Right.
research fellows, what
Right.
have you. And then we have a lot of patients who are of very low socioeconomic status,
Sure.
who struggle with things like food security or housing security. And so
Right.
it's just kind of opposite ends of the spectrum a lot of times going from one room to another, and it's whiplash sometimes because we get
Right.
the questions like that, like, can you explain oxygen saturation across the placenta? And then and then you get The opposite end, where you have a patient that tells you, my belly button's been sore because the baby's pulling on the umbilical cord, and you have to take a pause for a moment to understand, what does she think is happening here?
Yes.
Um, and, so you do kind of walk that line as a sonographer of trying to educate versus, making sure you're getting a good diagnostic exam and trying to do the best thing for the patient, but also referring to the provider when you might need to.
Right. 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 So, what kind of advice would you give then to someone who may want to become a mentor or, begin? Well, first of all, let's just talk about your website. I think it's It's a beautiful website. You've put together some really good work, and
Thank you.
I really appreciate um, the tabs about community. I think one of the reasons for me creating the podcast was to create community, like
Hmm.
leaving your information so that people can contact you
Yeah.
or it's always, especially like counseling, not really, you didn't call it counseling, mentorship, and what did you call it on the website? Something on how to handle professional difficulties or something of that nature.
Yeah, yeah. So I think navigating professional challenges and career
Yes,
development, I think
navigating.
sometimes those go hand in hand, um,
Yes, right? But
unfortunately.
man, do I wish I had somebody, right? Like I think
Yeah.
everybody can have needs somebody, right?
Right, right. Well, and I think some of where Echo Mentor grew out of, which would love if people would check out the website, it's echomentor.com. Some of what sort of fostered Echo Mentor was what I've heard time and time again from some of my friends or colleagues, especially those who are at maybe more rural hospitals or that are at locations where there's not as much of a collaborative team the way there have been at institutions I've been lucky to work at, is that they just don't feel like they have a person to go to.
Right,
They don't have somebody championing for their career growth. And for those people, I think that the opportunities are out there, and we have to kind of just look outside our little space or a little corner of the world to sort of see what those are. And I hear from a lot of sonographers that they're ready to take their career to the next level, but they don't know exactly what it is. And I think you had mentioned this the other day when we were chatting, and I think it's a really good point that in a lot of sonography departments, there's maybe a lead sonographer, and then maybe there's some sort of practice administrator or bigger leader. Um, but our departments may be large, and those people retire once every 40 years.
right,
Um,
right,
and so it can be tough to get those positions. And I think it's really easy for departments to feel competition with each other, especially for departments that are primarily women, which ultrasound is a primarily woman dominated field.
right.
Um, Unfortunately, I think society kind of pits women against each other in a lot of ways.
I
Um,
agree.
and we're really comfortable with being competitive with each other. And in academic institutions too, I think there's a lot of competition when it comes for, applying for grants or research projects or funding. And so there's sort of this natural inclination to maybe see your peer as almost a competitor or an adversary.
Right,
But I think it's so important that we build the kind of departments that you were talking about where, six of us are having a really tough personal time. Let's lean on each other and help build each other up and get through the day together. Because there's
right,
nobody, unfortunately, that we spend more time with than our colleagues at work,
right,
if you're working full time. You know what
right,
I mean? You spend
right,
40 hours a week, sometimes more, especially in healthcare. People are pulling long hours under taxing emotionally and physically situations. Um,
right,
and so it's nice if you can kind of support one another and build each other up in these situations. So Echo Mentor, we kind of created as a space to hopefully give individuals that may not have access to that community throughout our ultrasound space. And so Echo Mentor, like I mentioned, offers continuing medical education credits because we know people are interested in learning, they're interested in growing. But I think more importantly, offers those mentorship services. So we have a couple different product offerings right now, which we're always expanding and growing. So really interested to hear your listeners' feedback. But things like resume review or mock interview skills, these I think are sometimes things that we're interested in doing, but we don't have somebody that's in our particular niche to kind of give us feedback on those things. So the people on our mentorship team who are giving feedback on those things have actually been hiring managers. They've actually reviewed applications, they've conducted interviews, they know what people are looking for.
Right.
Um, or we also have sort of the career mentorship services, which are for people that are like trying to figure out what their next step might be. How do
Mhm.
they navigate these personally challenging situations? What else is out there for me? And how do I get through the day to day, or how do I get to the next level? So kind of being that community. Um, we also have sort of our community space with our message boards and things like that. So we launched in April officially. And we
Congratulations.
actually just yeah, we actually just premiered the company kind of to our community at SDMS, so just at the end of September. So we're definitely in a growth period. And it's
Awesome.
been a wild couple months, but we're having so much fun.
That's awesome. Well, you're doing some great work, and I wish we had it sooner, but I'm super excited that we as a community are coming together to support this kind of thing. Um, because I wish I would have met you at STMS. I was just there and I didn't see
I don't
you.
know how we missed each other.
I don't know either. But at STMS we talked about the advanced practice sonographer, right?
Hmm.
And I think it's because like when you come out of school, we're teaching you these are the images the doctors want. This is what you have to get. And so you go in and you do it and you come out and you go in and do it and you come out, you go in and do it and come out and you do your report on everybody, right?
Yep.
But you are nowadays going to where you're not having that relationship with the physician, right? So
Yeah.
the physicians used to be our mentors, right?
Hmm.
My mentors were a lot of physicians. Okay, why do you want that? What's that going to tell you? How do I get there? Okay,
Yeah.
this is what I'm seeing. And they'd help me work things out. And that's how I learn, right?
Yeah. Yeah.
And that's kind of being gone by the wayside a little bit.
Yeah. Yeah. And for
So,
some of my friends that work at smaller community hospitals where they utilize
right,
services like Nighthawk, or
right, right,
teleradiology and things like that, they might not even interact with a physician who's actually looking at their studies at all.
right, right. So being able to post or in the community, hey, has anyone seen this? Or can anyone give me feedback on this? Or
Hmm.
is there a place I can go to learn more about appendicitis?
Right.
There's
Right.
still a case that haunts me to the day. When I saw that on your website, I thought, I think of this case every time, that I did, that I knew he had appendicitis. I couldn't find the stinking thing.
Right.
And
Yeah.
so yeah.
Yeah. Well,
It's
and
a
I hope,
terrible thing to go into the radiologist and say he's got it, but I can't find it, right?
yeah, yeah. I think it's so important too. And this is kind of like one of the things that is the hill that I will die on when it comes to mentorship is let other people learn from your mistakes so that they
Right.
don't have to make all of them themselves. And I had a miss years ago that if any of my physicians are listening to this, they're going to laugh because they're like, Christina is obsessed. And many of my colleagues know it's my obsession as well. It was an isolated cleft palate, which
Okay.
is a very hard diagnosis to make on ultrasound.
Yes.
Um, and I fixated on it for months. And um, my MFMs would know when when I performed a study before I would walk into the room because there would always be a uvula picture in my study because it was off protocol because I knew that if I
Mm,
saw that bifid uvula, that it was a cleft palate. And I spent a lot of time researching what views can help me make sure I'm making an accurate palate diagnosis. And
okay.
that was what I came up with. And I taught all of the sonographers in my lab how to do that uvula picture. And it did catch on eventually. I don't know if it stuck around as long as it had for me. Um, but I think that those stories are so important because the reality is, unfortunately, that we're all human. We're
Right.
all going to make mistakes. We are not infallible. And I think letting others be aware of those mistakes and seeing that how, I handled this was learning from it, not, hiding and wanting to crawl into a hole afterwards,
Right.
and owning it,
Right.
um, I think just is really important. And I hope that because of that, my colleagues don't miss a cleft palate.
Right. Well, you learned from something and made it better, right? And so that's what I tell all the people that I train is I'm telling you to do it the certain way because I missed it. Yeah.
Right, right.
And everyone who has had 10 or more years will tell you that. No, you
Yeah,
have to do it this way because if you don't, you'll miss it.
right.
Which yeah, it can kind of be one of our downfalls, right? Because we're so systematic, so we don't miss anything that change becomes really hard for us, right?
Yeah. Yeah. And I mean, I forget who told this to me a while ago, but I think it's so true that if you're a sonographer and you've never missed something, you've obviously not been doing ultrasound very long.
Right,
Somebody didn't tell you,
right.
or you're lying.
Yeah. I like it. Yeah. I was talking to another educator and somebody had told her, I never missed a liver mass. And she's like, how do you know?
Right, right.
You know, did they do a CT after every one of your exams? And did they
Yeah,
report back to you on every one of you, like you don't know what you've missed unless they tell you. Now, I will tell you, shit rolls downhill. So typically, if you miss something, you will be told, you know?
true, true. But I think it
Yeah,
depends on the type of department you work in too. Um, because there are some places where I feel like like these things might go to the manager might know you miss things, but that person feels uncomfortable talking to people about it. And so it kind of just goes into a list and piles up, and maybe 7 months later you might hear something at a performance evaluation and you're like, oh my gosh, why didn't anyone tell me this?
right,
So I think too, part of being a good mentor is being able to give feedback honestly, that timely and in an emotionally intelligent way, so people have an opportunity to actually learn and correct. Because otherwise, that growth part isn't happening.
right, right. So, do you have a particular strategy in which you give feedback?
So, it's so hard to boil down to one strategy because I think part of being an emotionally intelligent mentor is adjusting sometimes dependent on the needs of your mentees. Um, I have some people that can handle a very direct approach. They don't want you to beat around the bush. They just want the facts, and what your recommendations are, and they want to move on and do that. And
Mhm.
I have other people that are maybe a little bit more sensitive, and that's not necessarily a bad thing. I'm not saying one is better than the other. But maybe that person I have to offer a little bit more of a, I guess, coaching type feedback. You know what I'm
Yeah,
saying?
yeah,
Um, and
yeah,
I think part of being a good mentor is just being able to adjust those tactics in the same way that we adjust our tactics as sonographers when we walk into a room where a patient needs us to explain circulation versus a patient needs us to just take a couple cute pictures of their baby that they're so excited about.
right, right, right. Yeah, I always kind of like to, regardless of how I think the delivery method is different, but I think I always try to, I think of an Oreo, do something, hey, I really like the way you did this. We have a
The
little work
the
to do on this
uh-huh.
area, but I also like the way you took a picture of that foot,
Yeah.
or, you know,
The
so that,
compliment sandwich or the shit sandwich, as some would say.
what would you say?
The
Oh,
compliment sandwich or the shit sandwich, depending
yes,
on who you're
yes,
asking.
right, right. But I know that we are our own worst critics, right?
Hmm.
And so for a lot of us, and for just women in general, right? We have to learn to be kind to ourselves, right?
Right. Yes.
And um
Yeah, that
so
old saying that nobody can ever hurt me the way that I can.
right, right. And so I think part of mentorship is saying, yeah, we have some work to do, but you still did this and this really well.
Yeah.
Like trying to put it in perspective, because
Hmm.
I think I know I probably sometimes still do. Gosh, dang it, why did I do that? And I beat myself and beat my, instead of saying, oh, okay, I need to work on that. But overall, things are good. You know,
Yeah. Yeah.
Recently I had somebody come into me and they're like, okay. And she had a paper and she goes, okay, you didn't do this, this, and this. Like there were 9 things. It was day 2 of a brand new job because I'm a traveler, right? And then she says to me, how do you feel? And I was just like stonewalled, it's just like, how am I supposed to feel?
Yeah.
What's the right answer here? Is this a trick question?
Right.
Because I'm like, well, I don't feel good after you telling me 9 things I did wrong, right?
Yeah. Yep.
Um, but there were a lot of things I did right too, you know,
Yeah.
but that wasn't really mentioned, right?
Hmm.
And so when you're coming in and trying to make a good impression and trying to work hard and trying to do things quick and, you know, things, you miss things because you didn't know that that's what they wanted, right?
Right.
Or you didn't know what the expectations were yet, you know. Uh,
Hmm.
so I think it's interesting of giving feedback is a huge skill of a mentor. Um, I think. Uh,
Yeah. And it's tricky because like you said, I feel like human nature is such that I could tell you 10 things you did great and maybe one thing that you did not so great. And at the end of the day, the thing you're going to remember the most is the thing that I said you did not so great on. Um, and that sometimes is challenging to navigate, especially when we're all in departments that are very busy,
right,
have a high volume of patients that, we might be feeling a lot of pressure to scan quickly or we're short staffed. And, you have to try to make time to give this positive feedback that feels not so necessary in the moment per se. But when something happens where you have to give negative feedback, that most of the time is very necessary, especially in
right,
medicine when
right,
people's lives are potentially in our hands. If
right,
someone's doing something that's unsafe, or if someone's doing something that's going to result in a misdiagnosis or, have some sort of adverse outcome, it's important that we give that feedback right away.
right,
And so, one of the things I think that's important as mentors is you have to kind of carve out time in your day to make sure that you're giving feedback that's positive as well, because, that feels a lot less urgent, but it's just as important when we're trying to build up a mentee.
right. Because you have to understand from their point of view, right? Where they're coming in nervous and anxious and hoping to do a good job, but know they're going to fail at it, a couple times before they get it right.
Yeah,
And
sure. I've been that person.
yeah, haven't we all, right? Yeah. So I'm super excited about your launch and your program. And I'm I I think everyone needs to be a part of it just to get community. and it's nice to maybe sometimes just get an outsider's view on the issue at hand.
Yeah. Yep.
And just owning our own stuff, right? Going
Yeah.
into situations or um out of situations. And so, yeah, relationships can be tricky. You
Right.
know,
Right.
mentorships can be tricky. A lot of my mentors are physicians, because we
Hmm.
work so closely with them. So, um, it's sad to see that go away, but it's super exciting to see Echo Mentor become such a place for a resource
Yeah.
for all of us at all different walks of life.
Yeah, thank you so much. I feel like really the goal with Echo Mentor is just to kind of fill that void in the community space. And it was so nice talking to individuals at SDMS because there were a couple talks about sort of related topics and mentorship and things like that. And I think that I just kind of heard time and time again, this is unfortunately a gap in our community. We have societies that may or may not be specific for sonographers. And people are excited and interested in those societies and kind of the work that's happening, but maybe they don't really know how to get involved or they don't want to be involved in such a big formal capacity. They just maybe want to be involved in how do I launch a program at my office? How do I start a quality improvement program? Things like that. I don't even know how to get started and they have no one to ask. And so I think really kind of being that community where people can ask those questions in a safe space, they can work with a mentor. We have a program that we're hoping to launch before the new year that is kind of more professional development and has sort of different videos and interviews about with people who are kind of talking about different sort of things that a sonographer might want to do, like writing a case study to get published,
Right.
or how do I make a poster for one of these national conferences?
Right.
How do I start a research program? What kind of research programs can I start? How do I get funded? And so we're hoping to launch that before the end of the year. That's kind of just a how can I grow my career program? I'm
Yeah.
sure we'll
Oh,
come
I
up with a
love
catchier
it.
name.
Sign me up. I would love to learn some of those.
Yeah.
Because I would love to learn. Yeah. I think as sonographers, it's time to step up. It's time to step up to the plate and to make ourselves known. But to do that, we need to write, we need to research, we need to publish. And there's a ton of things to do. Like
Hmm.
I would really like to see someone take hold of the topic of diabetes,
Yeah. Yeah.
right? Because nothing's been written since I think 1970.
Wow.
No new guidelines, no nothing. And I mean, it would be a huge undertaking, but how rewarding would that be to really
Right.
shift the kind of care for diabetic patients,
Hmm.
you know? Um, so based on a study, and
Yeah.
I'm sure it'd have to be multi-site study and different things, but I think I think it would be super amazing for ultrasound people to really kind of start stepping up to the plate and um just to for nothing else, just to say, hey, I did that.
Right. Yeah.
Um,
So I had mentioned to you that I was just at a conference this week, and it was a congenital cardiac morphology conference. And so it was really interesting because as a sonographer, I feel like I have a lot of gaps when it comes to palliation of fetal
right,
cardiac anomalies that I see. I don't always get the side of what happens to that baby after it comes out.
right,
And
right,
so they had a surgery talk at the end of every day where the surgeon would talk about palliation of these defects. And one of the talks was really interesting. And the surgeon had sort of said at the end of this talk, so there were a lot of cardiac fellows in this room as well as imagers, but had said at the end of this talk, so if you have an idea, speak up about it because the reason we do this procedure is because a fellow at Boston Children's Hospital made it up. And maybe some of your ideas would be stupid, but maybe some of them would be really good. So it just, everyone in the room laughed when he said this, but I mean, I think it's so true that some of these ideas are being brought by somebody who's brand new, and they
Right.
didn't know the history of it's been this way for 80 years, so that's why we do it this way. And they
Right.
asked the question, why don't we do it this way instead? And that was enough to get everyone thinking about it and say, why don't we do it that way instead? That's
Yeah.
interesting. Let's try
Yeah.
it.
Let's try it a different way.
But
Yeah.
ultrasound as a whole is only about a 50-year-old career. Um,
Correct.
and so there's a lot that we don't know, and a lot of these paths haven't been forged in the same way that older healthcare professions like, nursing
Nursing. Yeah.
or physicians have.
Right.
And so we're really kind of creating those paths as we go, which I think is something that's exciting, but is also challenging.
Right. Right. Yeah. I hadn't been to the SDMS for about 4 or 5 years, I want to say, and
Hmm.
I came away from there just being so excited
Yeah,
about the possibilities, of where we're going to be going in our career. Because I think, as we spoke earlier, you get out of, when I came out of school, you got out of school, you're an ultrasound tech, and that's it. You're just an ultrasound tech. And now, you and I are creating places and things for us to do, um, outside of ultrasound, within ultrasound, that can really enhance a lot of, um, our potential as a
right,
profession, I think.
right. Yeah. So I guess if there's one takeaway that your listeners should take out of this whole thing is
Yes.
don't wait for a health administrator or an HR department to give you that path. You don't have to wait for a formal job description. You don't have to, take a formal role. You can do really whatever it is you want to do. And you don't need that necessarily. Those things might be helpful in some circumstances.
Right.
Um, but if you're interested in taking your career to the next level, then seek the person who's going to help you do that and figure out a way that you can do that with or without the support of the place you work.
Yeah. Yeah. I think it's out there now.
Yeah,
It didn't used to be, but I think it is. And so stay curious, you
definitely.
know, stay curious, do
Stay weird.
research, and get creative, right?
Yeah.
Curious and creative, because there's a lot out there for us. And technology has done amazing things for us, right? Like, never would I ever have thought that we can do a full cardiac exam on a fetus, right? Way back when I started. Um, and now it's just amazing. It's
Right.
phenomenal,
Yeah.
and to think of all the babies' lives that we've saved or um changed or were prepared for,
Hmm.
because we knew ahead of time and we knew how to handle it. And so, yeah, um, it's exciting to see the
Yeah.
technology change, but now I think we're bringing in more emotional intelligence and mentorship and other training that will really help us go to the next level quite a
Yeah.
bit.
Definitely.
So thank you, thank you, thank you for your work and your passion and following your passion and following your curiosity. One last question I ask every guest, before we end is, what is one thing that you do maybe outside of work, that increases your frequency?
Hmm. Increases my frequency.
Like makes you happier
Yeah.
or helps you get rid of stress or
Yeah. So, I guess two things. I
okay.
would I would put them on equal level, but one I have more access to. So
Oh,
I try to spend a lot of time in my garden, which is
oh
kind
yeah.
of like my safe space. So this is something I started doing in COVID. It was my COVID hobby that stuck around. Um,
Okay.
And now my whole yard is landscaped. Like we don't have to have anyone come in and do it. My husband, don't tell my husband because he thinks we're saving all of this money on landscaping when I'm probably spending just as much money at Lowe's and Home Depot.
Awesome.
But I would say that just has given me such a, on really tough days, that's just given me such a space where I can kind of come and collect myself. And it's been such, I guess, a godsend for my mental health. And similarly, I really like being in the water. I really like snorkeling and I really like scuba diving. But unfortunately, those are expensive hobbies and I live in the Northeast. So between trips to the Caribbean or beaches and warm places, I have to settle with gardening. But
Awesome. I love it. I think that's great. Now, vegetable garden or flower garden?
flowers. So although I will
Flowers.
say this maybe is a conversation we should take offline, but there was a large component of my garden that was for edible cocktails and cocktail fixings, which was also born out of COVID, but I think is important for people to consider when they're doing their landscaping.
I love it.
But yes, primarily floral.
Wonderful. Wonderful. Well, thank you again for your time and for your contribution to our profession. And we wish you well in your endeavor. And to our listeners, please go to the website, echomentor.com, and check it out and sign up. And there's definitely some courses there I'm for sure going to be taking. And enjoy.
Thank you so much.
Thank you.
Thanks for having me, Debbie.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.